was weird. Okay, good afternoon, everybody. Brittany and I are going to do a presentation on the Johnson family.
Okay, so our learning objectives for this are to develop a plan to assist in problem solving on a family health using the nursing approach.
Meet the Johnsons. Mom is Jessica, and she is 30 years old. Dad is Mark, and he is 38. Justin is 7 years old, and Emily is 2 years old. The maternal grandma is Sarah, and she is 58. The maternal grandpa is Bill, and he is 60 years old. The paternal grandma is Lorelai, and she is 57. And the paternal grandpa is Jack, and he is also 57 years old.
Okay, so just briefly touching on each of the family members. So the mom, Jessica, is a 30-year-old female, 46 kilograms. She's 5'2" tall, and she works full time. The dad of the family, Mark, is currently laid off. He has about 4 or 5 drinks per night, and he's 110 kilograms. Son Justin is 7 years old and has autism, and he requires a full-time care worker. The daughter Emily is 2 years old. She has full-time daycare, but she also has separation issues. The maternal grandmother is 58 years old. She works full-time, but she also provides part-time childcare for the family, and she's also a smoker. The maternal grandfather is estranged from the family, and he's also an alcoholic. The paternal grandparents, Jack and Lorelai, are also somewhat estranged from the family just because of the distance. They live all the way in Saskatchewan. And because of that, they are having some trouble having limited contact with the
family. The Johnson family eco map. So what I created is Mark and Jessica. They're having a stressed relationship due to Jessica being the full-time breadwinner, as well as their lack of sleep due to both children struggling to sleep at night as well as their troubles in school. Jessica works full-time, so she has a good relationship with her work. There's a weak relationship with Justin's school due to the fact that he is very disruptive in class. So that's putting a strain on the relationship with the school, as well as it would put a strain on the relationship with his friends. Emily's daycare, same sort of issue. She is also being very disruptive at daycare, causing her mom to have to leave work early to pick her up because she is so unconsolable. There is a good relationship with the maternal grandmother. She provides childcare part-time. And the paternal grandparents, there's a weak relationship due to them living in Saskatchewan. And there's no relationship with the maternal grandfather, seeing as he's an alcoholic and he's been estranged from the family for years. And again, there's no relationship with Mark and work because he was laid off due to COVID.
Okay, so here we're seeing how each of Erickson's stages of psychosocial development affects each member of the family. Jessica, her stage is intimacy versus isolation. Her need for intimacy with her family is suffering because she's stretched so thin between work and the responsibilities of the family that are crucial for their everyday operation. Mark's stage is Erickson's generativity versus stagnation. He's struggling with stagnation due to the loss of his job. However, the spare time that this gives him, he could be working on his generativity within his family. Justin is currently in the industry versus inferiority stage. He's struggling for his sense of competency, but the negative responses to his disability seem to keep him in an inferiority stage. Emily is currently in an autonomy versus shame stage. Emily is at an age where her need for autonomy is overshadowed by her shame for her inability to be independent as of yet. This is causing her to lash out a bit. Sarah is in the generativity versus stagnation stage as well. Her generativity stage is very evident in the way that she cares for and provides for her family and in her concern for their well-being. Bill is also in the generativity versus stagnation stage, and he is in stagnation, heavily so. It's where his self-absorption is consuming his life, and he can't see how his addiction is affecting his family. The grandparents, Lorelai and Jack, are also in the generativity versus stagnation stage. Their need for that generativity and familial relationship is overshadowed by the stagnation that's caused by the distance between the two families.
The assessment is she's having digestive problems. She was recently diagnosed with colitis. She smokes 5 to 10 cigarettes a day. She's worried about finances, and she uses her sick days due to her recently diagnosed illness. She has a strained relationship with her husband. And she also is dealing with a child that has a developmental disability. She has sleep loss related to her child, number one, the oldest, due to his recent diagnosis of autism, and possible loss of wages related to Emily because she is constantly having to leave work early to pick her up from daycare because she is so upset. The diagnosis is she has caregiver role strain related to being the primary caregiver. She is the only working parent, and she is having less sleep. She's at risk for impaired attachment with her children due to her recent diagnosis of colitis, as well as her being so stressed. She also has stress overload related to excess stress and insufficient resources to help with her family. Our plan is to educate about healthcare, advocate for the family, direct to available resources such as food banks, social workers, and identify the stressors so that those can be worked through and make a plan to reduce the stress that is caused on her. Implementation, connect with Samaritan Community Garden, 7th Street Access, connect with welfare, educate, and counsel, change diet, encourage healthy eating, and help her to realize that smoking isn't helping her in any way. Our evaluation is to visit every week to reassess and see that this plan is working for her.
Okay. Bill is Mark is the father. He is a 38-year-old male, 110 kilograms, 6 feet tall. He's laid off. He has 4 to 5 drinks a night, and he has a sedentary job and financial stress due to his being laid off. He smokes a pack a day. Moving even just short distances leaves him short of breath, and he has sleep loss related to Justin, child 1, and possible lost wages related to Emily, who is child 2, because again, having to leave work and go and pick her up. His diagnosis is he's at risk for impaired cardiovascular function, and he's at risk, move the screen so I can see, at risk for unstable blood pressure, and he's at risk for substance use, at risk for financial related stress, including depression, and he's at risk for being overweight. He has ineffective coping related to job loss and dysfunctional family process related to his addictive personality and ineffective coping skills. The plan is to communicate effectively and get his consent and cooperation. Without that, we can't continue forward. Educate him on the effects of drinking and refer him to counseling for that. We want to get him to set some real goals on weight loss and identify any other stressors that contribute to his current behavior. Implementation. We're going to educate him on the danger of smoking, refer him to employment acquisition resources such as job bank or social services, refer to a social worker and health and addictions resources. And we're going to give him some information to help him find work. Evaluation. We're going to check on him biweekly. We're going to try and keep him on the plan and make changes if it's not working for him or if we find out any new information.
Justin. Justin is 7 years old. He has autism. It's a developmental disability. He requires a full-time care worker. He is disruptive in school. He has poor sleep patterns, and respite is unavailable related to finances. Diagnosis: determine the level on autism spectrum. Get referrals to see a speech pathologist and therapist. Advocate for him for social and financial support, and suggest seeing his pediatrician. Plan is to connect the family with resources for autism, get referrals to see it. I just said that. Implementation: connect with available resources for autism, advise to change to subsidized government approved early childhood center. And evaluation: biweekly routine check to reassess plan, continue to modify and change or stop plans as appropriate.
Emily. Her assessment, her vocabulary is only at 40 words at this stage. She is shy and she has separation issues. She is constantly crying at daycare related to those separation issues and intense, long-lasting temper tantrums. And she has loss of daycare due to this behavior. Diagnosis: impaired communication related to not speaking at an appropriate age level, inadequate sensory stimulation, and shyness. She has anxiety related to separation anxiety at daycare, and she is at risk for delayed development related to an economical disadvantage. The plan for her is, as she is behind developmentally with her speech and vocabulary, we recommend a speech language pathologist. We're going to inquire about the licensure of the daycare, or if Emily could be moved to a licensed daycare to facilitate that referral with the pathologist, because then the parents wouldn't have to leave work to bring their child to an appointment with the pathologist. The pathologist can go straight to the licensed daycare and see Emily there. Also, a licensed daycare would provide quality care that would also help with Emily's attachment issues and could help stop the crying and temper tantrums that often get her sent home, alleviating the parents' need to miss out on work. So the implementation is referral to the Brandon Speech and Language Clinic. All the information is right there. And evaluation: we're going to speak with the family, caregivers, pathologists on milestones and goal achievement biweekly and modify that plan as needed.
Sarah. Okay, Sarah. Her assessment. Sarah works full-time and provides part-time childcare for the family. She smokes heavily and is possibly overworked. Her diagnosis: at risk for cardiovascular disease and, due to smoking. Stress overload related to excess stress and insufficient resources. Our plan is to educate the need to quit smoking, maybe assist in finding assistance on her finances, educate on autism so she can help her grandson, educate importance of self-care, and identify stressors she may be facing. Implementation: refer her to counseling so she can discuss these stressors and have someone safe to talk to. Evaluation: response to interventions and evaluate her willingness to make changes, and again, follow up with her biweekly, make sure the plan is working for her and that she feels supported.
Okay, so Bill is and has an alcohol addiction. He has longtime estrangement from the family related to that alcohol addiction. His diagnosis is dysfunctional family process related to alcoholism. The plan for him is education on addiction and its effects on familial bonding. We're going to set some goals to help motivate compliance and encourage accountability for his alcohol addiction treatment. So the implementation for that is going to be referral for addictions counseling and encourage membership in an AA group for sponsorship support. Um, and the evaluation, we're going to talk with client about achievement of goals and modify plan for any barriers. So we're going to do that weekly checkup, because addictions is often very difficult to deal with. So he needs a little bit more help and support to overcome
Lorelai and Jack, the assessment, live in Saskatchewan. They have limited time with family and limited contact with family related to their distance because they live so far away. Diagnosis, interrupted family process related to changes in interaction with community. Developmental crisis, situation, transition and or crises, developmental transition and or crises. Plan, educate on new technology such as Zoom, FaceTime, or simple online games that allow for immediate family to interact for quality relationship building. Implementation, refer them to Saskatchewan Community Development and Outreach Program for further assistance. For evaluation, check on their ability to interact with family and their satisfaction with how they're interacting with their family since they are so far away. So just trying to get them connected is what we can do.
that. Okay. And here are our list of references. Thanks.
Thank you.